Lung cancer is the deadliest form of cancer. This year, 127,000 people in the U.S. are expected to die from the disease, that from the American Cancer Society. Now, during this Lung Cancer Awareness Month, Ascension Saint Vincent Hospital in Evansville is offering extended hours to make it easier for busy people to be screened for lung cancer. And joining us now from Ascension Saint Vincent to talk about all of this is Dr. Christopher Nelson, a pulmonologist, and Dr. Michael Thomas. You are a cardiothoracic surgeon, correct?
Yes,
I want to make sure I say that right. Thank you both for being here. We appreciate your time today.
Thank you.
People typically think of lung cancer of a heavy smoker who smoked for a long time. Is that realistic? Who is getting lung cancer nowadays?
So tobacco smoke is generally the risk for it. Anybody who's been a heavy smoker, anybody who's a little bit older, the general age range that's the highest risk is age 50 to 80 years old, and anybody who's smoked pretty heavily. Other things that are risk factor are things like radon. That's something that can be in a house. So you need radon mitigation systems and detection for that.
How would people even know that, though? Do you have to have a detection system to know if you have that? Okay.
It's tested for when you buy a new house.
But if you have that, you need to be screened.
Correct, yeah.
Who else needs to be screened? Is it just what Dr. Nelson said, or are there other people in general that this isn't something that everyone needs to go out and get screened for? Is that correct?
Typically just the heavy smokers, you know,
Really?
Advanced age, 50, 55 above, people who've smoked over 30 pack years. So if you smoke 1 pack per day and you've done it for over 30 plus years, then you need to be screened. And that's the general population, and that's a lot of our folks around here.
And I think we were talking before we came on here that Kentucky has quite a high rate of lung cancer. Is that correct?
It's one of the highest states in the nation for lung cancer deaths. It's all, you know, if you look at the maps, it's all red or all blue, depending on what map you're looking at, but yeah.
Right. So folks there may need to listen closely here to what we're talking about as far as screening goes. It's
Absolutely.
Worthwhile to get screened for this. What is a screening like? How is it detected?
So it's a low-dose lung cancer screening CT. So basically it's a CT scan where you lay down on a bed and you're eased into a machine to get a CAT scan of your chest. It's actually fairly quick. There's no pain. There's
lay
no
there.
Contrast, correct.
Yeah.
So it's actually quite easy of any screening thing.
Right.
It's the least invasive.
No pain, anything like that.
Correct.
Okay. And then as far as the treatment goes, is that what goes into a treatment?
So treatment depends upon the stage of the lung cancer. A higher stage lung cancer typically require chemotherapy and radiation therapy, but a lower stage I'd actually like to have Dr. Thomas talk about.
Yeah, please do.
So low stage lung cancer that's what we want. That's where surgery does its best. Until stage 1, stage 2. But stage 1 is where we really help people the most, and that's why screening is so important. If you get a stage 1 lung cancer found during screening, your chances of being alive in 5 years is 75 or 80%, versus if you start going stage 2, stage 3, it drops really rapidly. Difference at 5 years between stage 2 and stage 3, or excuse me, stage 2 and stage 1 is double. Like your chance of being alive if you get a stage 1 versus stage 2 at 5 years is twice as much if you get a stage 1.
So early detection is key.
It's key.
I say that all the time with
Absolutely.
breast cancer, but it's true with lung cancer as well, it sounds like.
That's correct.
Okay.
Yeah.
Talk about your screening coming up. You have extended hours on Saturday, November 11th, correct?
That's correct.
And
yes.
people just need to call and make an appointment, or do you take walk-ins? Do you know?
There's an appointment phone number on the monitor.
Okay, all right, and I think we have it up right there.
Yep,
You're looking
correct.
at it right here. That's Saturday, November 11th from 9 to 2. Call that number to make an appointment. And if you can't go that Saturday, you do have screening going on at other opportunities as well. So if you need screening, don't let that one day, that's just extended hours that day. Screening is available at other times as well. So make sure you get your screening. Dr. Thomas and Dr. Nelson, thank you so much for spreading this word out there so people know to get screened.
Thanks for having us.
Thank you.
Appreciate it. We'll be right back.